Dear students, I am Professor Ayman al-Madani, and today we are going to talk about a very important topic which we all face in our practice, which is what we see in our clinics. The headache patients, they only represent the tip of the iceberg. It's a minority of patients. It's only 1/3 of patients. All of us have headache uh, one day or another, and he didn't go to seek medical. Again, a very important point is that headache is no man's land disease. Headache is a symptom of an underlying disease. Many specialties share the treatment of headache. We have the otolaryngologist, the neurologist, the maxillofacial, the pediatrician, the psychiatry doctors. Many specialties share the treatment of this symptom. Headache actually is a dilemma. Why? Because it is not one type of pain, it's a spectrum of pains. Antibiotics make the diagnosis a bit confused. Again, the referring physician is very important. Many patients go to neurosurgeons, to neurologists, perform an MRI. The MRI came that the brain is free and there is some sinus opacity, so they refer them to the otolaryngologist for assumed sinusitis. You will face the problem that the patient is coming to you complaining that his or her sinuses cause of headache. Subjectivity, we cannot prove whether the patient has headache or not. We also don't have any confirmatory investigations. Symptoms vary from one attack to another. Like in special types of headache as migraine, we have variable attack to another. For the sake of simplicity, the International Headache Society in 1988 put a classification which have classified headache into two main types, primary and secondary. And actually, they put a classification of 300 subtypes. Clinically speaking, when we are talking about 300 differential diagnoses, it's too long and complicated for use in day. So we classify headache into two types. Primary headache constituting about 90% of cases, and secondary headache constituting about 10% of cases. Primary, which is the 90%, tension headache is the commonest, to be followed by migraine. As regards to the secondary, sinus pain constitutes only 15%, and then come the other causes like the trauma, the tumors, meningitis, and so on. So from this slide, you can see that the commonest cause of headache ever is stress-related, which is tension, to be followed by the vascular type, which is the migraine. Then sinus pain only constitutes about 15% of the 10% of the secondary. So if we put it in an equation, if you had 100 patients suffering from headache, 90 of them are primary, and from the 90 you have 80% tension. Let us say we will have about 70 patients suffering from tension headache, 15 patients suffering from migraine, and then 1 or 2 patients suffering from sinus pain. From the otolaryngologist's point of view, we classify headache into two forms, the sinogenic, coming from the sinuses, or the non-sinogenic, which is not sinuses. Sinus pain, or the sinogenic, could be either inflammatory or non-inflammatory. Inflammatory, acute and chronic sinusitis. Non-inflammatory, all other causes that can affect the sinuses can lead to headache. Criteria for sinus pain to say that the headache is sinogenic, coming from the sinuses, we have, as you can see here in this slide, it's a pain rather than a headache. It is usually localized over the sinus. It is dull to intense. This is the character. Usually it is worse in the morning, and it is aggravated by bending forward, and it is worsened by any sudden temperature change. The last three items is due to what we call the reactivity of the mucosa. There is usually mucosal congestion and the swelling which takes place during sleep or during temperature exposure. This is the classic picture of acute sinusitis. Patient coming with swelling over the cheek. This is the CT scan, and this is the picture of endoscopy. Now, what about the non-sinogenic? The commonest two types are the migraine headache and the tension. When we talk about the migraine أو الصداع النصفي, this is the vascular type of headache. It is usually throbbing. It is not necessarily unilateral. It could be to one side, it could be to other side or the whole head. The duration and frequency is variable. So migraine is a vascular type, throbbing, not necessarily. We have different types of migraine. The common forms is the one that comes without an aura, while the classic, this is the one which comes with the 4 phases, as I will show you later. And then we have the complicated type of migraine. So the commonest type of migraine is the one that comes with. These are the phases of migraine. You have the prodrome, you have the aura, you have the pain, you have the resolution. This is the classic type, which is only present in 20% of cases. Common type of migraine is the one which comes with the attack only, without all these stages. These are 3 questions which help you diagnose the patient with migraine. You should ask about nausea. Is he nauseated or not? You should ask about the limitation of the activity, and you should also ask about the sensory attribute, light or noise. If the patient is nauseated, if the patient headache limits his activity, or he is sensitive to light or noise, that's to say he has 3 positive answers, then 98% of the patient is suffering from migraine. But if he has only 2 positive answers, then we are talking about 93% patient migraine. Tension headache, this is the commonest type of headache ever. It is a muscle type of headache. It's a band-like band, and it is mainly occipital type of headache. Again, duration and the frequencies differ. Supposed to be more in females. They are more prone to stress. Tension headache is something which is related to the muscles of the neck. All of you have suffered tension headache one day or another before the exams. Once the exam is finished, this type of headache terminates. So tension headache, it is muscle type of headache. This table shows you the difference clearly between the migraine and tension. This is the migraine, the vascular. This is the tension, muscular. Here, migraine, unilateral, but not necessarily. This is occipital, diffuse. The location, temporal. This is diffuse or occipital. Migraine, it is moderate to severe type. Patient with migraine cannot go to his work, while patient with tension can go to his work. What about the frequencies differ? Migraine, it is pulsatile because it is vascular. Tension is dull, muscular. Family history, aura, GIT, sensitivity to noise or light, they are all present in migraine. They are not present in tension. Again, movement exacerbation is present. What about the headache alarms? All of us have headache, but sometimes you could have what we call an alarm. Headache that makes you very suspicious. If you have the sudden onset first headache, worst headache ever, late onset new headache, progressively increasing headache, these are all. Headache with any neurological signs, headache with any manifestations of increased intracranial pressure, headache with fever, rash or stiff of the neck, this is what we call meningitis, or headache with mental changes. This summarizes a lecture about headache, and to sum up, Headache is no man's land symptom. It is not a disease, it's a symptom. Many specialties share the treatment of headache. Commonest causes of headache in order is the tension, which is a muscle type of pain, migraine, which is a vascular type of pain, and then comes the sinus pain. Sinus pain has certain criteria, should be respected to diagnose the patient as having a sinus problem. Again, we have what we call the headache alarms. These are very important to be put into consideration when treating headache patients. Thank you very much.